It comes from an awful lot of different directions. We are out knocking on doors and we hear ideas right then for legislation. I think my colleague, Representative Krista Griffith, pointed out we're less lawmakers than problem solvers. So we may hear of a problem when knocking on a door, and that problem, the solution to that problem, may take the form of creating a bill. I've had times where I'll have a bill idea handed to me from a member of the administration. I'll have one that is handed to me by an organization. I'll have one from knocking on a door and finding out that if someone had a drug offense, they lost their driver's license, they're allowed to get a conditional license in order to keep a job, but not to actually go to Del Tech and get a degree so they can get a job. So, we get ideas from all over the place. And what I want to do is, because of time, transition to my colleague, David Bentz, as the chair of the Health Committee. He has a really unique perspective because that committee does so much work to talk about all the different areas that Health Committee bill ideas come from. David?
Thanks, Paul. So yeah, they really come from everywhere. There's not a single kind of source, a single way that the bills come to you. When they come from sort of the real grassroots level, the constituent level or advocacy level, they tend to come as problems and not as bills. They tend to, it tends to be somebody sort of explaining a situation, something that isn't working right, or some interaction with government that they didn't think was, the best way for that to work. Or, in healthcare, it's, they had an issue with their insurance provider, they had an issue with the health system, a doctor or something, where they couldn't get care they needed, or it wasn't delivered in a way that they thought made the most sense. So how do you sort of improve on that? So, that tends to be, when it comes from the ground level, how it comes, and then they sort of look to us to often be the ones who fix it. Now, if you have a really well organized advocate, that's great. Maybe they bring you a bill, maybe they bring you model legislation, something that they've heard of that's passed elsewhere. But a lot of times it starts with that problem, and then it's engaging with the people who would know how to fix that problem, across the board. And something like healthcare, for example, it's going to be, you go to the payers, you go to the providers, you go to the patient advocates, you go to the health systems, everybody who's kind of involved with this, and say, why isn't this working the way it should be? You engage regulators and the administration, DHSS, and there's so many different groups, but healthcare is kind of a good example of sort of how many people you often have to bring to the table to really look at a problem, understand it, and figure out a path forward on how to fix it. And just to make matters even more complicated, all those groups I just mentioned will also bring you bills or ideas from time to time as well.
Thank you so much. This next question is for Representative Griffiths. So what is the process for a bill, generally speaking? Say you have an idea for a bill, how do we get that from that idea to the governor's desk? We have about 3 to 4 minutes for this question as well.
Thanks, Ann. It's a great question. And thank you, Delaware United, for inviting me to be a panelist. And I'm just going to take from what my colleagues Paul and David said. What happens is, and I'll use an example of what happened to me as a representative, and I think it's illustrative of the process. So I had a constituent read an article in New Yorker magazine about how a med student was horrified because while a patient of hers was anesthetized, she was asked to do a pelvic exam routinely on the patient, and the patient had not consented to that procedure. So routinely, back in the day when patients were anesthetized, medical students might perform pelvic exams on them to sort of learn how to do that. Anyone who's gone in for surgery for, say, a thyroid or whatever, you consent to that treatment, and you need to make sure that that's the only treatment you're getting and not any other exam. So she approached me and she said, "Why does Delaware have any law against this? Because this is unsettling." And so what happens with that idea? I'm like, well, that's a good question. Let me look into it. So when you have an idea, you approach your policy team and you say, look, this sounds not right. And I want to make sure that Delaware doesn't, has a law that prevents this. So the policy team will take the idea and will do research on what the existing Delaware law is, as well as other states, to come up with a policy proposal. As that process is happening, I'm doing my chatting it up with my colleagues and friends about it to sort of test the idea out. Are people upset by this? Is this something that they want changed? I'm talking to the groups that I know that might be interested in the legislation. So while the policy is being developed by a policy team, I'm doing my own research by talking with constituents in some of my circle to see what they think. So when the policy team comes back with a proposal, it will include what other states have, similar legislation, or maybe there's no legislation from other states, and so you're sort of creating the law. And that can be exciting, although sometimes it's much easier to have another state to model after. And then we can tweak it according to Delaware, what Delaware wants. So as soon as the policy is back, as I've been talking with colleagues, I've also been thinking in my head, who would be a good Senate sponsor for this bill? Who in the other chamber has similar views on this issue, or who have I worked with before, or who may have a constituent affected by this? So at that point in time, you start reaching out to your colleagues in the other chamber to get a sponsor in the Senate. So then you get your bill drafted, you look it over. In this case, I think because it involved obstetricians, gynecologists, doctors, we talked about it among the medical community to see what feedback they would have. We took that feedback. I don't think there were any changes to the bill. It went to the House first. The House would pass it. Well, first it goes to a committee process. It would go to the Health Committee, most likely, which Representative Bentz chairs. It would have a hearing before that committee in which the public would be able to comment. And then the Health Committee would determine whether or not to release the bill, which means that it would be up for a full vote in the House. So in my case, the bill was released to full vote.
30 seconds.
It passed the House. It went on to the Senate, same process over in the Senate, passed the Senate, and then it went to the governor's desk and he signed it into law. In our bill, we made it happen about 2 months. We gave it a 2-month lead time to get people used to it, but the bill is actually now law, and the process took only about 4 months. Thank you.
Thank you, Representative Griffiths. Moving along to our next question, and this one is for Representative Minor Brown. How have you adjusted your community engagement to ensure you're representing your constituents during COVID compared to prior the emergencies or orders being declared? And then a second, what is one thing you still are having a hard time adjusting in this regard to now that you now that you've recognized this as a challenge?
Thank you, and good evening, everyone. Delaware United, thank you for having me, and thank you to everyone who tuned in this evening. So, I mean, a lot has moved to a virtual platform, but there's still a lot of people that don't use social media. So my office, we send out constituent newsletters, we send emails often. I've made phone calls to some of my most vulnerable constituents. Last year, when we had to make this change in the way we were used to working, we began getting a ton of emails. A bulk of the constituent concerns mid-pandemic were related to unemployment. And that has now taken a turn towards testing and vaccinations. So, we respond to emails as they come, but it's also important to stay in communication with your civic associations in your district. Many of my seniors in my district are involved in civic associations, and a lot of my seniors do not use social media. So that's a way to keep engaged with them, as well as just being able to stay abreast of what's going on in each development. Your second question, to be honest, I'm just going to be completely honest with this answer. Like I'm just a people person, and I like to hug, I like to socialize, and everything has changed so drastically over the course of a few months, now really a year now. And these adjustments
30 seconds.
A toll on everyone, on our whole state, not just the pandemic, but the civil unrest that myself and my colleagues and other individuals throughout our state have had to struggle with. We've had to cope with all this via Zoom and social media. So it affects your mental health, your physical health, our jobs outside of the legislature, our households. But at the end of the day, underneath the legislator hat, there's a nurse hat. And underneath the nurse hat, there's a mom hat who's raising 2 kids, who's also impacted by the pandemic. So what I will say is with every struggle comes strength. So, and this goes for myself and all my colleagues, I believe that what will evolve out of this is stronger legislators, stronger legislation, which will in turn create a better Delaware.
Thank you, Representative Minor Brown. I'm not sure if anyone else wanted to add on to that response.
I echo everything that my colleague Representative Minor Brown said, and I also think that I've seen Representative Bomback do a lot of town halls that have been good. He's consistent with having those, and I think he started those, I think, Paul, like long ago. So transitioning to the pandemic wasn't so tough for you because you had already sort of built in that that communication through your town halls. So I know I borrowed on that concept in the pandemic, and Paul, you were a good role model for that. So I think, utilizing social media, and as Representative Meyer Brown says, the old fashioned calling people, knocking on doors. I did a lot of that. I didn't knock on doors, but I did a lot of calling dozens of people from March to present.
This is Representative Morrison. I'll just jump in and say, it also really increases the volume of constituent services you're doing, because you're not only dealing with the normal, drainage issues, road conditions, things like that, but for example, I spend a lot of time working with the Division of Unemployment, trying to help people get their unemployment. I spend a lot of time helping people trying to understand how to get their first and second doses of vaccines. All kinds of things like that that are on top of your normal constituent services.
Wonderful. Thank you so much. This question is for Representative Johnson. As the chair of the Delaware Legislative Black Caucus, could you tell us some history of the caucus and how it came about and the work that you're doing now?
Absolutely. Yes. Thank you. Thank you all so much for having us this evening. So I'll start very broad. While the Delaware Legislative Black Caucus is a newer thing here in the state of Delaware, what you ought to know is that this type of caucus exists throughout the United States. So there is the national level, it's called National Black Caucus of State Legislators. Okay, so up here you have the National Caucus, and then you have each state, if they so desire, to have their own Black Caucus. So while it is a new thing here in the state of Delaware, having a Black Caucus is not a new idea at all. The Black Caucus was, we started in the 150th General Assembly. Our founding member is Representative Stephanie T. Bolden. I remember her pulling us all together soon after, I believe, we won our primaries, and pitching the idea of, hey, let's have a Black legislative caucus here in Delaware, because quite honestly, it was the first time where the state legislature really had the number of Black people to pull something like this off. So that's a little bit about the history of the Delaware Legislative Black Caucus. And as you see, you have multiple Black Caucus members here on this Zoom with us. In the 150th General Assembly, we crafted what we called our Agenda for All, which really highlighted what many Black people were experiencing in 2020 as a result of the social unrest, the George Floyd murder, Ahmaud Arbery, the list could go on. And our Justice for All agenda really, it has legislation, that was important for that time and for what the country was experiencing. So we had legislation about chokeholds. We also passed legislation for discrimination here in our state. And actually that had to go through two General Assemblies. It went through the 150th. It also went through the 151st, and that's Senate Bill 191. And that speaks, explicitly to have protections against discrimination based upon race here in our amazing state. We're still working on other portions of the Justice for All agenda, such as requiring body cameras. We believe that that's going to happen shortly, considering that Governor Carney actually included in his recommended budget $3.6 million to go towards that. Let's see, what else? I'm speaking quickly because I don't want to hear the bell ring and then I have to stop. There are a number of other very important topics that we are in the process of discussing right now. So our Justice for All agenda that was created in 2020, those things still remain. We still remain committed to making sure that we pass each piece of legislation that was outlined in June of 2020. And what we're doing right now, since our caucus has grown tremendously to 12 members, what we're doing now is we're evaluating our Justice for All agenda, evaluating and updating our Justice for All agenda so that it is inclusive of all of the members. And I didn't hear the bell, so I'm going to stop now.
Thank you so much. Very much appreciate that. And that's incredible background and context. This next question is for Representative Bentz. So what would you say is the most effective way people can still push for what they believe in when they cannot come down to Dover due to the legislation being shut down? And each person who'd like to respond has about 2 to 3 minutes for their answer.
I mean, I'll say this, you can still get in our ear, and that's always the best way to sort of ensure that we don't lose track of what you all think should be our top priorities. You have us here today. We're not hard to get a hold of. Some of us are probably more responsive than others, but I will say that I don't believe COVID-19 has reduced the amount of feedback I'm getting from constituents. If anything, it's increased the amount of feedback I've been getting from constituents. Anytime you sort of have a crisis, something that sort of puts people in tough spots, you start to hear more. Crises sort of expose the cracks in the system and the way things aren't working the way that they should be. And I would say it's only ratcheted up, the outreach that we received. So, I can't speak for all my colleagues, but I read every email I get. That inbox comes right to me. I don't have somebody skimming it for me. My cell phone number is not hard to find. I'm not just going to announce it right here, but if you just look around a little bit, go to my website, you're probably going to find it. So I don't close myself off. I don't make myself hard to get a hold of. And most constituents, I think, understand that and continue to reach out and activate and serve as activists for the causes they believe in, and that hasn't stopped at all. So what I would say is you go through those traditional channels still, even though the in-person stuff has maybe been cut off because we're not meeting in Dover, but continue to reach out through email, through phone calls. And if you are part of a group, one thing I've noticed, and I saw we have some Moms Demand folks here, always my favorite groups. Groups are moving towards virtual lobby days. What they used to have was they'd have lobby days in Dover where they'd come down, everybody would wear like the same t-shirt. They'd set up meetings with legislators and they'd get, everybody down there one day and set up as many meetings as they could and try to connect legislators with constituents that they had within the group if they could. And what I've seen is groups start to try to shift that to an online platform where they host almost an event like this, but instead of it just being open to the public, being open to that group and that group of activists, and making sure that meetings are still happening, that legislative agendas are still being explained to legislators from various sort of I don't want to call them lobbying groups, but activist groups, grassroots organizations that would usually come down to Leg Hall and show signs of force in that sort of way. So you could continue to have those if you organize that way and reach out to folks, and you may see that you're not going to see any more resistance to meeting with you and hearing your
30
concerns.
seconds.
I can stop. More than willing to hand over the microphone.
Sure, I'm not
Yeah,
sure if anyone else. Go ahead, sorry.
I think social media has been mentioned. I think it's a strength and a weakness. I think with COVID-19, I think we're more reliant on social media. If you are on social media, I think you absolutely have a lot of opportunities. Most of us have Facebook pages, as David said. Sorry, we're going to use first names here. I'm Paul. Just reach out through Facebook to your representative, to your senator, and try to get a response that way. We all have emails, and I think Dustin may be sharing the emails with people. Even if your rep or your senator doesn't read the email themselves, their aide does. You're going to have eyes on it. And as I often say, for the minority of people who are not served well by their representative, you've got a senator too. So if you hit a brick wall with your representative, work with your senator or vice versa. And if that doesn't work, as David says, work with the organizations you're part of, whether it be civic or whether it be advocacy groups. Delaware United is a great example. We're all there to represent, to be responsive. And it is best if you start with your own elected official, but if you hit brick walls there, really don't be leery about reaching out to a neighboring representative or senator. We're out here to help the state and help bridge the gap between you and the rest of the state government. And for that matter, if you have a federal issue or a city issue or county issue, we'll try to get you to an answer. So just reach out, communicate. Because we can't hug as Mimi would love to do, we're just trying to be as in touch and reachable and responsive as we can.
I just wanted to jump in there and say, just do not allow this pandemic to prevent you or discourage you from advocating for something that you believe in. If you believe in it, you hold that fire to the very end and it will get done. Just keep that motivation, keep that drive. Anything is possible. Just don't let the pandemic discourage you. Don't let the social media platform get in the way of getting it done.
And I'll say, this is Representative Morrison, just real quick, the wonderful groups like Delaware United, Network Delaware, the issue campaign groups, a great way to get involved is to get involved with them. It's hard out there on your own to try to make change sometimes. So don't be afraid to reach out to these groups. I guarantee you, no matter what issue you're passionate about, there is a group in Delaware fighting for it, whether it is a single issue group or whether it's a group like Network Delaware or Delaware United. Trust me, there are people you can link up with.
Fantastic. Well, thank you to all of the senior and returning legislators for the answers to their questions. We're going to now turn it over to Representative Morrison and Representative Lambert as our freshman legislators. So I'll start with you, Representative Morrison. What was the most surprising thing coming into the legislative session compared to when you had the meet and greet last year? And each of you could have a couple of minutes to respond to this question.
The hardest thing for me to get used to has been the legislative process itself. Kind of what Krista was speaking to earlier. How do you get that idea from your head or from what someone wants you to do into law? And that's something I've had to learn a lot about. I actually got a couple of policy people on the phone one night a couple of weeks ago, or more than a few weeks ago. I said, I don't understand this. I said, I am a business analyst by trade. I need bullet points. So we sat down for an hour and we hammered it out, and they did a great job. And now I've got my bullet points. As of today, I have my first 2 pieces of legislation being written by House lawyers. So that's been the biggest challenge to me, is just learning and understanding that process. And it really gives me a lot more of an insight into the window of why it all often takes even years for an idea to go from an idea to legislation. It doesn't make me happy that it is that way, but it is that way. And sometimes it actually makes the legislation a lot better than what you would have started with.
Thanks for the question, Ann. And I want to thank everyone that tuned in, everybody that joined us on the Zoom. So many familiar faces, so many great advocates. We appreciate all of you. For me, one of the things that surprised me the most about being a legislator is the pace. It happens fast. And for me, it really is a new space. I love it. I'm enjoying it. I'm learning so much. 2 weeks ago, I submitted my first piece of original legislation dealing with environmental justice and keeping our families safe. But at the same time, some of these spaces weren't always designed for all of us to have a part in them. So, the space that I come from here in Claymont, I haven't always had access to politicians, to understanding how everything works. So for me, it's just an honor that people voted me into office to represent them. And I take that role quite seriously, quite literally. I want to represent the historically disregarded, the overburdened communities, the vulnerable, and being that voice, now being in office, it's great to now learn how it works. No matter how fast it gets, it slows down a little bit every day. And I'm really looking forward to continuing to build relationships and work with my colleagues down in Dover.
Thank you so much, Representative Lambert. And to keep the conversation with you, wanted to find out what policies have you been advocating so far this year, and what issues are you hoping to introduce during the next segment of the session?
I mentioned that I'm working on an environmental justice piece of legislation. I'm actually working on a second one as well. So for me, I'm very passionate about that. But the main part of my platform that I'm leading with is economics and education. Because what's the point of staying in school if there's not a decent paying job at the end of it? For me, I'm advocating strongly for the $15 minimum wage. We've just went through an era where we're in the middle of an era where we call our grocery store workers, our brothers and sisters that are cleaning our senior assisted living centers, we call them essential workers. It's time to make sure that their compensation is essential. I'm also passionate about abolishing the youth and training wage. State-sanctioned age discrimination is not acceptable. I also want to make sure we work on the tipped wage for our wonderful tipped workers who are also essential workers during this time period. And on the education space, I am really passionate about House Bill 100, providing mental health for our young people K through 5, as well as House Bill 86, providing special education to our students K through 3.
That sounds incredible. And Representative, oh my gosh, totally drawing blank. Representative Morrison, anything that you'd like to add from your perspective?
Well, in terms of what I'm working on and what I'm excited about, and some of it overlaps with Larry, and I have to say I love working with Larry. And one thing we're working on together is the minimum wage stuff. We've been on a few calls about that. I actually, when I first saw the bill, I thought this needs to be better. So there are 3 things that I came up with and did a ton of research on and put together some slides about how it can be better and why. One of those things we've already gotten in, which I'm very excited about. 2 of them, it looks like we're going to get in, the other 2. So I'm excited about that. So sometimes it's not just about your legislation, it's about looking at other legislation. I've also met with the sponsor and policy folks surrounding the cannabis legalization bill to talk about that. So some things that I'm working on, and right now I'm co-sponsoring, I think about 60 some bills, and I'm co-priming maybe 10 bills. The 2 bills that I'm working on, I'll say, I don't know if I should, but I will. Why not? One of them is actually that's being written is to require employers in Delaware to give 2 hours of paid time off for folks to vote. Another one is to require employers in Delaware to give paid sick time to employees. That's different from the long-term stuff being introduced by Senator Sarah McBride. This is for actual sick time. I think we saw, and to Larry's point, what's the good of paying lip service to our essential frontline workers and telling them how great they are and how they've been during this pandemic if we're not going to back it up with actions? A lot of them don't have paid sick time. And I know of folks who went in when they thought they had COVID or they had been tested for COVID, and they're there. They're putting your produce out at the grocery store. They are serving your food at a restaurant. They're folding your sweaters, and it's not their fault. They cannot afford to stay home. So that's something I'm really passionate about, so lots of different stuff that I'm passionate about: criminal justice, labor, education. So lots of good stuff.
Sounds like you've got the right audience here to talk more about those things in the breakouts. One more question, a couple more questions here. So for both you and for Representative Lambert, how has the reality of working in Legislative Hall changed? What issues you've decided to prioritize or focus on first?
I'll jump in on that one. And I'll say, well, two things with that. So first of all, it's hard not being in Legislative Hall. And I haven't worked in Legislative Hall yet, like maybe Paul has or Krista. But it's hard. You can't poke your head in somebody's door and go, hey, do you have 2 minutes to talk about this bill? It's very hard doing things virtually. So I'll say that first of all. But and now I'm totally zoning out. What was the second part of your question there?
That was basically it. Just how it's the reality versus what you had envisioned has shifted the focus of the issues you prioritize.
Yeah, the other thing too is, there are things that I would love to work on that I just know at this point just don't have a chance. It's just not out there. And I'd rather focus on things, certainly not easy things. I'm not focusing on easy things that are going to automatically get through, but focusing on things that are at least somewhat possible because I want to help as many people as I can.
Yeah, that's a great question. And I always enjoy working with Representative Morrison too. He's a great advocate. In regards to how what I've experienced in Dover impacting my legislation, for me, my style is to be proactive. It's important that when new obstacles come your way, new opportunities come your way, to stay focused. And my campaign started with the people. And the people's needs, as they change, as they grow, as they evolve, that will impact my legislation. But as far as anything that happens down in Dover, it's important for me to stay focused on what the people want.
Wonderful. Thank you so much. And last question for you, Representative Lambert, and then we'll hear from Representative Morrison. What do you feel, in your experience thus far, is the most effective method of advocacy, or what really seems to be getting through and to get your attention as a freshman legislator in the COVID era?
For me, I just want to encourage everyone that the most important step is the first step. Whatever you can do, wherever you stand, just try. And for example, if you can hear my voice, if you can see my face, just you participating, just you making it this far is a great first step. There's wonderful organizations out there, as has been mentioned earlier, such as Delaware United, Progressive Democrats. We have advocates on the call from ACLU, Moms Demand Action, Indivisible, Highlands, just so many you can't even name them all. However, it's important just to try. Never give up. There are obstacles out there that make it seem like it's unsurmountable, but I'm living proof that your advocacy can work. I should be a statistic. I'm the first person in my family to graduate from college. I made it here, overcoming a lot of loss in my personal family, but what I've gone through is no harder than what anybody else has gone through. Persevere, don't give up, keep advocating, keep fighting. And if you feel like you don't have a voice, reach out to me. I'll be your voice.
Larry just gave me inspiration for a great piece of legislation, which is that I never have to follow him on a Zoom call. Because Paul said that before. Larry's just so inspiring. But you know, Larry's right. I mean, when you look at me, you look at Larry, you look at Marie, you look at Medina, you look at Ray. I mean, who would have thought? I didn't think all of us would get in. You know, election night, I'm in here with my team screaming because of everybody. And we're like, I won, Medina won, oh my God, Larry won. So, you know, if you had told me that all 5 of us had won, I swear to you, I would have, it's not big, but I would have bet my entire savings account that that would not have happened. But we all just fought so hard and never gave up. And we have to have that in activists as well. And it's hard. It's hard. You look at some of this legislation like minimum wage and repealing the youth and training wage and cannabis legalization, and you think, why the hell isn't this stuff done yet? And it's so frustrating, but you just have to keep going and going and going, and you get a little closer. It always reminds me, especially as a gay man, of same-sex marriage. There was a time in my life when I truly thought that we would never pass same-sex marriage in my lifetime. And we fought and we fought and we fought. And it seemed like one day I woke up and it was done. And then you're going, holy shit, we did that, you know, and it's really exciting. So just never, ever give up. You'll get there. Just keep pushing.
Representative Morrison, you're certainly inspiring in your own right, but thank you to all of these incredible legislators for giving us your time this evening. Is there any other questions that I've teed up that others would like to respond to that haven't had a chance yet?
I just want, sorry, I'll be really quick. What I've found over the years is that the best testimony is the personal testimony, and it's from the heart. And you know, being having a master's degree in public speaking or whatever it happens to be, having reams of data from across the country and the globe is not the same. Susan's on this call, and some of the most powerful testimony for End of Life Options Act is the picture of her husband, Ron Silverio, and telling his story. That is, you as a legislator cannot ignore those personal from the heart stories. And frankly, you're more effective than legislators. So when you bring your heart to this effort, you make a gigantic difference. And I didn't mean to turn my picture off. So please keep your heart in it, lead with your heart. And we will be so thankful because you're going to make a great impact with that. Thank you.
All right, well, I'm going to transition it back over. So thank you all for your time. And I think we're in a good position to spend some quality time with each of you in the breakout sessions.
Yes, wonderful. So, and this is why we asked that everybody please update their Zoom, because that will make this part much, much easier. So if you've updated your Zoom, I'm going to open the breakout rooms in a second. So I wasn't able to fit the whole description in each of the names of the breakout rooms. I don't know how much you guys will be able to see when they open up. So breakout room 1 will be Representatives Minor Brown and Morrison. They will be speaking to corrections, criminal justice and racial justice reform, healthcare and economics. The second breakout room will be Representative Bentz, Johnson and Lambert. They will be speaking on healthcare, racial justice, environment, elections, and labor. The third breakout room will be with Representatives Griffith and Bombach. They will be speaking about economics, environment, technology and consumer protections, and healthcare. So when I open up the breakout rooms, and you know what, why don't I paste that into the chat? Because I doubt anybody can remember that from the beginning. There we go. So when the breakout rooms open, you can select one of those rooms. Now, that doesn't mean you're stuck in there the whole time. You can come out and you'll be prompted to select a new breakout room, be able to change rooms. Each room will be moderated by one of our DU members. please, the same rules apply. These guys and these ladies and gentlemen have taken some time out of their day to spend with us. So please be cordial. If you don't get the best answer that you're looking for, I recommend that you email to follow up. But we want to keep the conversations moving to make sure everybody gets a chance to ask their question in the breakout rooms. So please try to be as concise as possible in your question and direct. We ask that you try to stick with about 60 seconds for the breakout rooms. If you go over that, our moderator will probably interrupt you and put you back on mute. I'm going to allow everybody to unmute themselves now, and you'll be able to mute and unmute yourself. When you're not speaking, please make the moderator's life easier and mute yourself when you're not speaking in the breakout rooms particularly. So now I am going to go ahead and open up the breakout rooms for everybody. So all the rooms have been open. If you don't see the prompt for you to join, you may have to go to the bottom of your screen to get the menu, and there'll be a little kind of like, 4 little tiles there that say breakout room. You can select that. If barring that, if you still can't find it or figure it out, oh, I need to allow people to unmute themselves here. There we go. If you still can't figure that out, you can put in the chat where you would like to go, and I'll try to get you there as swiftly as possible.
Dustin, I don't think I updated my Zoom. Would you mind putting me in Yanni's room?
Sure. There we go. So yeah, so you can either pop off mute and just tell me where you want to go, or you can put it in the chat. Up to you. And I can put you there.
Can I go in Paul and Krista's room?
Yep. You should get a little pop-up. There you go.
Dustin, would you please put me in number 2?
Yep. There you go. Should get a little pop-up. There we go. Jack, you want to go anywhere in particular?
Room 1.
Off you go. Zita, room 1. There we go. Julie, I got you. There we go. On the phone, you want to go to 1. There you go.
Hey, Dustin, David here. If you could put me into 1. I upgraded, but I'm not able to select.
Yes.
Thank you.
David, room 1. Janice, room 1. Trying to get caught up with the chat here. All right. Mike, is there anywhere you want to go?
1 or 2, either one's fine.
All right. So we have Susan LaHaye, I believe.
Yeah, put me in whichever one has the least amount of people in it.
All right, sounds good. I'm gonna invite. There you go. Teresa, is there any room you would like to go to?